I hope there's enough storage on this phone to get through a video, and right now for me the most convenient way to do it is from the car. So I think what I want to do is go over today the difference between what I would call a visceral chiropractic adjustment or just a nervous system based adjustment, which by the way, all chiropractic adjustments are nervous system based adjustments if they are actually inputted to where there's a joint cavitation, aka cracking, pressure gradient change, because that does send a stimulus to the brain. Now that input to the brain back down the spinal cord, right? That exchange matters. How it impacts your frontal cortex, how it impacts other parts of your brain that are responsible for your detection and or perception of the environment and movement matters very much. And that's just it. The deeper, the faster and more impactful that the stimulus hits, and how it impacts your nervous system is very important when it comes to reducing sympathetic tone. And that's something that I think the physiology and the neurology support very much, that if it's not that like they can prove that you're like sympathetic dominant, but if you have less norepinephrine and less levels of hormones that are indicative of being sympathetically dominant, aka stressed out and scared, right? And then you go into a much more relaxed tone, a lot of times that's going to help you in terms of just like overall tension, which may be leading to things like high blood pressure, irritable bowel, constipation. I'm just trying to think of some other ones here while I check my rear view, but you hopefully get the idea. Now, let's assume that you are getting an adjustment only for pain. So we're talking about pain-based management of care. I'll give you the kind of classic example. You're a 38 to 52-year-old person who is very active, whether you work at a factory or whether you're a person that works out every day or runs every day. Or maybe you do still work out every morning and you're very tired from it, or every evening and you're very tired from it, and then go sit at a desk for 8.5 to 10 hours with really tight hips and your lower back is really tight, okay? That classic example of what I just described to us working American folk and vast majorities of the rest of the world, that is a tendinous, ligamentous disc kind of pain management patient for chiropractic. That stimulus that's going to be received by the nervous system is still going to impact you the same way that I just described, but there's a pain gate cycle interruption that we're trying to manage and negate and change people's patterns. And then those patients, that patient base, are also going to have a little bit more stringent recommendations when it comes to exercises that they need to do at home to shorten certain muscle fibers and lengthen other muscle fibers, and really start to reverse habitual patterns that are impeding on your way of life that you don't want to have happen. You, as the consumer, should be understanding that there is a big difference between the nervous system stimulation that goes into each one of these adjustments and each one of these care plans or trials of care that a chiropractor in particular is doing with you, a patient, or me, the patient. And I want you to remember that, because you could, have a friend that had a great experience with the chiropractor who got an adjustment and a lot of their pain or their discomfort or their symptoms went away. And they're like, he's a miracle worker, go see him, all these other great things. But in reality, you may be the person that is suffering with an area that has stenosis, that's narrowing of a canal or a spinal nerve root being impinged. You might have the annular fiber of the disc that tore in an incident, but there's a lot of scar tissue in that area, and inflammation will manifest itself in that area, causing a lot of chronic pain that a lot of the times gets exacerbated to where it's very annoying. You are the person that's going to need a lot more, not just care, but a consistent pain-based approach of chiropractic. Now, I hate saying that even because a lot of chiropractors don't like to say, oh, we're not about pain, it's not about pain, it's about maintenance. And it is. Believe me, I go to the chiropractor religiously every other week now, and it has helped me immensely. Even before, when I did have stenosis, before I had my back surgery, I went to the chiropractor religiously. It helped me immensely. It is irreplaceable. But there are certain conditions that I think that there should be almost an instant lifting of symptoms. One of them is vertigo. I believe vertigo should be drastically better in an acute bout with a chiropractic adjustment done right, and the way that it impacts the nervous system and reduces inflammation and balances the brain and stimulates the cortex. Okay, all the things I said in the beginning of the video. Whereas I believe also migraines and headaches should be feeling much reduced or significantly better or gone, within a day of an adjustment, maybe two. I also believe that somebody who has a disc herniation, and the older we get and the more it's flared up, you might be looking at 2 months of care. And that's just the way it goes. And it's not because chiropractors are out there trying to tell you, 30 visit care plans. It's because if you come in as a classic lower back patient who fits the age demographic I discussed, we'll just go ahead and call it 38 to 52. I don't know, I'm just, I'm probably right on, but whatever. You are going to need a month to 2 months of chiropractic care. And in the beginning, it's going to be a lot. It's going to be often. And you are going to have to see the chiropractor and work in what we call combinations and patterns of specific adjustments that will help you feel a lot better, greater range of motion, reduce pain, and on the road to healing. With that, I'm going to cap this video off here. I'm going to be done with it. And I hope you guys continue to tune in. There's been a little bit more engagement recently, and I will continue to post the content as I have the time and see that it is educational and informative to you. And until then, you all have a great weekend. And remember, the eclipse is coming to Dallas. Stay home on Monday. Don't look up. Bye.